injury, in the post-injury situation, and the video has a three parts. The first part is the focus on your sternum and pelvic floor muscles to correct your postures. Second part is actual exercise. We have 6 different directions only today, and we don't do so the things that it might be too much for you today. And then the third part is a little dance. So the idea is, I think our body knows how to fix it themselves. So the first part, you first sit to find a chair that I need your knees not like this and not like this, but like more or less 90 degrees. And you might have, with the pain, you might have like these shoulders or the try to support your spine, and you might have unnecessary tension on the center of your torso. So you first just drop your shoulders and shift your weight side to side to find your weight on your directly on your sit bones. And place it straight. And taking your palm and give a little press on your chest, the middle of your chest. And this bone is connected through your ribs into your spine. So to mobilize your spine, you don't need to think about spine, but let's think about your chest and the breastbone. So start giving a little pressure towards the ceiling to lift up your sternum and drop to curl and head follows. So lift up your sternum and drop to curl. And lift up your sternum, drop to curl. Lift up your sternum, drop and curl. And when you feel okay, you can start to lift up your sternum, breathing in from your nose, and start looking up just a little towards the ceiling. So far you don't have a pain in the shoulders and neck, please. And you shouldn't do like this. You relax your shoulders, and you shouldn't do like this. So keep your head up that you can still produce some voice. And drop your sternum to curling. And we start to activate abdominal muscles together with the movement. So now when you drop your chest, you start not the center of your torso or the navel bottom, but far deep down. You pull towards your spine and curl. So you can imagine you have an ice cream spoon and you take an ice cream out of your belly. So you have in to open and exhale to curl. Scoop your belly in. Ice cream and in to open and curl. And 2 or 3 more, please. If head is too heavy for your chest, you can just come until here. So far, you don't feel any stress, please. And 2 or 3 more. And you start to rotate. So you have now open your chest, curl. Open your chest, curl. Front side, back side. Front side, move your sternum, back side. It's like a little jazz dance. Back side, front side, back side, front side, back side, front side, back side, front side, backside, so so and 下ですね。And then under us come other way around, front side, back side, front side, and back side. And then meanwhile, you keep your abs up. And keep breathing, never hold your breath, and try to create a smooth circle, please. And each direction more than 7 times. So we create kind of like muscle memory. And back to the center. And now we go to the pelvic floor muscles. Sit straight and find your sit bones. And go a little front side and find your pubic bone and find your tail. And the in between is your pelvic floor muscle. Well, I don't have a picture. So you squeeze. This is your sit bones, and you feel like you squeeze your sit bones a little towards the center. So it might bring your head a little up. Hold it. And relax. So a few times. Squeeze up. And relax. 2 more. Squeeze up. And relax. Last one. Squeeze up. And relax. Now with your abs, we can do maybe thinner head cells, S breath, so like creating S sound. So we have breathing out to pull your abdominal wall in right above your pubic bone area towards your spine. And in the last moment, you squeeze your pelvic floor muscles and relax. Ne? So we have breathing in from your nose, exhale from your mouth. Squeeze up, relax. And 2 more breathing out to squeeze up. Last one, squeeze up. And last thing, you wanna lift up yourself. Squeeze up, and not from your shoulders, but you wanna lift up yourself from the bottom of your hips. So you wanna breathing out to hold it like a skiing and release. Squeeze up and holding your pelvic floor muscles and relax. And 2, 3 more, please. Squeeze up. Hold your lower part of your abdominal muscles and try to relax your shoulders and relax. 2 more. Squeeze up and relax. Last one, squeeze up and relax. And just squeeze up and then coming up, and you can just walk around the room. For the second part, taking care of it. With some exercise, we want to take care of the shoulders. So the first, just find your breastbone, and then find your shoulder, and lift up and down. Put your finger, hang on your clavicular, and just move your shoulders just a little. And lift up your sternum and place your hands on the outside of your leg, and then the other hand on your leg. And you push to make your back straight, and just going to little twist. And relax. Push and twist. And relax. Push and twist. And relax. And two more. Push and twist. And relax. Last one. Push, lift up your sternum and twist. And relax. Other side. Push. So place your hand outside of your knee. Push and twist. And relax. Push and twist. And relax. Push and twist. If it's a pain in the shoulder, just a twist. And two more twist. And last one twist. And then going to shoulder. So now you point your finger on your shoulder, so somewhere you feel comfortable with, and push to lift up your sternum just a little. So don't push too much, just place. It's like a pendulum. So you make a tiny circle with your hand. So keep lift up your sternum and a tiny, tiny circle with your hand. It's like a pendulum. Yeah? So really full relax. And the other way around, just a tiny, tiny circle. And go other side. Then we go like tiny, be like almost homeopathic. Almost nobody recognizes that you are making circle. Tiny, tiny, smooth circle, like a pendulum. So support your shoulder by just touching with your fingertips, and the other way around, a small, tiny, tiny circle. And now we have 4 exercises and 2 other exercises and 1 last to just relax the shoulders. I have today syllabus. So this is a 1.5 meter around, and I'm sitting on it. But if you don't have, you can ask to your family to support your exercise. The first 4 exercises, you better need to have somebody to support you. So the first 4 is direction. Let's prepare just a direction of the movement. Open. So like place your shoulders down, elbows down, like the Thomas, the Zug. So drop your elbows, and then we go open, 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 open. I hope it's not pain. Close, 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 and then close, fist, and then you go open your elbow, open your elbow, open your, this is the number 3. And then we have opposite, close your elbows, 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 close, close. So we have open, close, open, close. So the whole like this, and you shouldn't hang your elbow on your torso, keep it little apart. And ask your family to place your hand outside of your palm, and don't bend your elbow, don't bend your wrist, and you do open, push to open, push to open, push to open, push to open. So that give a little resistance. But basically your shoulder to your elbow is not change the position. No hang, no out, open, just a tiny, tiny movement. Your family hand stay, or the friend hand stay outside of your palm. And then we go other way around. So now ask to place the hand inside of your palm and give a little pressure. Well, I can actually do it with my hand. And keep lift up your chest, please. If you feel too much with the resistance, you can maybe start from only the movement. The 7 to 15 times. And if you feel okay, you can make a 1-minute interval and do it again. And then number 3, lift up. So now you make a fist, and not fist like this, but fist like this. And ask to, well, you can also hold something, but if your family is going to help, hold your elbow, actually, okay, hold your wrist, and you do lift up just a little. You don't need to lift up so far. Just a little, just a little, just a little, just a little. Lift up your elbow, lift up your elbow to give a little stress in this center line. And keep lift up your abs, ne? And we have the other way around. Close, close, close. You can now ask to give a little pressure and try not to bend your wrist. If it's pain, just reduce the resistance. Ask to reduce the resistance. So go to the other side. Other side I explain with the Celeband. So if you have those elastic band from your physiotherapist, 1.50 m something, and you can sit on it, the other side, and hold, and you go start from open, open, open. Those exercises are not mine. I learned in 2007 from my teacher. And it's make you something like this, getting tired, but keep lift up your chest, please. And keep lift up your abdominal wall. And then if there's somebody helping you, just again pushing, 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 pushing. Other hand, other side, close. So you take the same side, wrap and close. If it's do nothing, you can make it a little shorter. And if somebody is going to help you, push the palm. And take care, and not like this, not like this, not like this. And then we have now open again. Elbow up, wrist not up, palm not up, but palm towards your torso. Take the other side and don't bend your wrist and pull up, just a little. Lift up your sternum. And if somebody helping you, just hold your wrist and pull just a little. So the focus to the central line. Central line? Center line. And not lift up your shoulder. Don't lift up your elbow too much. If it can be too much, just like tiny a bit. And then you do other way around. Now close, so that the support like this. Or take the other side. Take the same side. Grab and close, 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 close. Close, 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 close. Last one, close, and relax once. And now we do, usually I do with Celebrant, but now you don't need maybe. So first again, the Thomas position. Zug. And pull, open your chest, close your shoulder blades so far you feel no pain, and release. Open and relax. Open and relax. No? Open and relax. Open and relax. Open and relax. Open. And then when you feel okay, you can just pull your elbow back and twist. So that not both sides, but only one side, pull and twist. And keep your chest up, scoop your belly in. And release, breathing out to twist. And relax, twist. And relax, twist. And relax, twist. And lift up your abs, lift up your chest, squeeze your pelvic floor just a little. And one more set, twist. And back to the center. And then last one, we do now so and Kreis, so a circle. So you do just a tiny, tiny homeopathic circle with your shoulder. Again, feel your clavicular. And again, tiny, tiny circle. And other way around, tiny circle. Feel the tiny circle moving your clavicular. And other side, tiny circle. Ooh, I touch my microphone. And then the last, just move your shoulders wherever you feel comfortable. And release your torso. And we go to the third part. So now the third part is a small dance. Small dance, I believe that our body know how to fix it. So that we have, take your fingertips and first just take your thumb and you massage your nail towards the tip of towards your fingertips. So the massage your fingertips towards the spit. And then now you do just hug your hands. And then grab, 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 and then you massage the middle of your hand. Somewhere you feel comfortable. If it feels comfortable, it's nicely pain, you can also press the bottom of your thumb. And massage the middle of your palm. And then we have for the wrist. So drop your fingertips, and then rotate your wrist. Drop and rotate, drop and rotate. So you keep touching to give a little impulse. And you drop and rotate, drop, rotate. Drop your fingertips and rotate. And each movement you can do kind of like 6-7 times to create a nice muscle memory again. And whatever the direction, just drop and rotate, drop and rotate, drop and rotate, drop and rotate. And we do same on the elbow, drop and rotate, 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 drop. And now you keep sliding your palm on the surface of your skin to give a little direction. So give a little pressure or without pressure, just keep sliding your skin to give a little direction, and you again rotate, keep rotate, keep rotate, and give a little direction, give a direction. So the first you do everything in a small scale, and then slowly you can move your spine to go to a little more bigger scale. But so far you don't feel pain, so when you get the pain again, you just relax once, breathing out, and then move it again, please. So don't move from your shoulder, but just from your periphery. And also impulse of your own palms. And the shoulder again, drop and rotate, either rotate or rotate, drop and rotate. And you can make it a little increase the dynamics. And if it's pain in the shoulders, just stay small, but let your fingertips move in the way they want. And then add your face, so you can watch the same direction with your fingertips, and you can go opposite direction. Better to keep touching, actually, so that you can go in the same direction. or tiny. And then you can go opposite direction. And then you can make it bigger and bigger with a tiny, tiny. So enjoy tiny, small dance. That's it. And then when you finish, just relax, drop your chest, squeeze your pelvic floor muscle again, drop your shoulders, squeeze your pelvic floor muscles again, and scoop your belly in, lift up your sternum, and relax. And place your palms together, front of your chest, in a little distance. And maintain the posture. And that's it.